Click Chart to access Patient Chart. On the bottom of the screen, you will be able to change to Existing. You are noting the patient's existing restorations or teeth that are missing. When selecting teeth to be missing, you can highlight all at one time. Click Missing and OK, and it will put X's over the teeth that are no longer there. The buttons found on the right side of the screen are utilized for existing or proposed recommendations. Beside each button has a drop-down menu where you can choose other services in the same category. For the posterior and anterior composites, there will not be a drop-down menu. You will click on the button itself to click the services that will be utilized. For example, here's tooth number 2. You will click Composite P for a posterior restoration. Once you click the button, a new window will appear. This is where you will note the surface of the existing restoration or the proposed restoration. When selecting the surfaces, they will highlight yellow. Click Save, and the changes will appear on the patient chart. Another example will be a crown on tooth number 3. We will go to the Crown Quick button, click, make sure it says Existing, and press OK. When noting areas of decay, you will highlight the tooth that has the cavitated area. On the right-hand side of the screen, you will click the Decay Quick button, note the surface of decay noted, and then it will appear on the patient chart. You can also utilize the button Condition. This will note any abfractions, broken areas, retained root tips, chipped teeth, bulky margin, anything that you want to highlight something special about the tooth that needs to be made note of. Most conditions will ask for the surface of the tooth so they can make the note on the chart screen. For example, tooth number 12, we are going to note that an area is broken. We'll click Use, and then we're going to chart the surface that the tooth is broken. There are more quick pick buttons on the bottom right side of the screen, and this is able to change from permanent to primary dentition. You can select all, you can clear all, or you can just click one button at a time. Say they never had a permanent tooth form. So we'll use tooth number 20. We're going to change that to the primary tooth, which is K, just for future charting, knowing and being aware that a primary tooth is in a permanent dentition.